really working while we're moving barriers out of the way for changing federal law, that we still have to work at the state level to improve these programs. And one of our biggest tools that we have to do that work is our State of the States report. And so to present a little deep dive into what the State of the States report is and how everyone can use it, I'm excited to introduce our Government Affairs Director, Abbey. Thank you so much for being here and for sharing this amazing tool with our members.
Hi, of course, and hi everybody who is watching from home. And like Steph said at the end of the last panel, I look forward to hopefully seeing all of you in DC in the spring. We can go ahead and dive right into this. Perfect. So every year we publish our State of the States report. Many of you have probably seen this or heard us talking about it. In this report, we go through and we grade all of the states and United States territories on about 200 or so metrics of things that we think are important for laws to include to make sure that they serve patients well. If we can go to the next slide. Our State of the States report has been published since 2014. Last year, we redid the grading rubric a little bit and we revamped it. So given all of the advancements in cannabis policy and medical cannabis policy, we decided to revamp the grading sheet and the rubric so it is an ideal law. If a state is for some reason making a medical cannabis law from scratch, if they just looked at our scorecard and added everything that's in it, we would consider that, one of the perfect medical cannabis laws. We also pull out gold states. So these are states in each of the categories that are doing the best. It's important that you know that these aren't perfect laws, but the highest scoring. And then in the State of the States report, we also provide an overview of state legislation and recommendations for policymakers. And of course, this is updated yearly. The 2022 State of the States report will be coming out in January, so in just a couple of weeks. So please make sure that you're signed up to receive our emails and you'll receive a notification when that comes out. You'll receive a copy of the report as well as action alerts and ways that you can get involved and help spread the message. Our grading rubric, these are the main categories that we look at, and I'll go into them a little bit more in a minute, but the broad categories are patient rights and civil protections, access to medicine, program functionality, affordability, health and social equity, which was a new section last year, consumer protection and product safety. And then we also have a penalties section. In this section, that is where states can lose points if their laws have things that are particularly dangerous and harmful for patients, things that actively harm patients. So because last year was the first year we revamped the scorecard, this report that will be coming out in a couple of weeks will be our first chance to see how the rankings of states have moved from year to year. Have any states made any improvements that made them gain rankings over other states, get higher scores over other states? And on the flip side, did any state change anything that actually weakened their program? So we'll be able to compare that starting this year. On our grading scale, an A, so this is if they get 100% to 90%, this means that the program's comprehensive and provides substantial patient protections. Last year, not a single state received within the A range. So that is just important to keep in mind. Again, the rubric is what we're striving for a perfect law. And unfortunately, so far, nobody even gets an A. There were just a few states that received a B. This means that it has a good medical cannabis program, but one that requires a few important adjustments to ensure that patients are fully legally protected. The bulk of the states received either a C or a D in last year's report. The C grade, they have a fair medical cannabis program. Some people have access, some people have easier access than others, but there are substantial improvements required in these states. And then for D states, this is, technically they have a medical cannabis law on paper. Some people may be able to access it, but most people have to drive long distances if they're even accepted into the program. And then we have states that have an F. So those are states that still just basically have a non-existent medical cannabis program, or no way to access cannabis if they say they have a program but don't have retailers, for instance. If we can go on to the next slide. So I'm talking a lot about the 2021 report, and that's because our 2022 report has not been released yet. So this just gives you the top line data and key insights from last year's report. The average grade across all of the states and territories was only a D+, not even achieving 50% of the points that we allocated that a state could earn. So, as we look at this chart, and particularly if you look at the pie chart, you can just really see the stark differences in what a medical cannabis law actually looks like. So we spend a lot of time talking about how there are 38 states with medical cannabis programs now, but when we say that, it sort of gives off the feeling that, okay, everyone in all 38 states has the same level of care. Just like if you think about chemotherapy or getting traditional prescription medications, it doesn't matter where you live, someone can get access to it. But that is absolutely not the case when we talk about medical cannabis. If we can go back, sorry, just once more. And then also you can see that quite a few states actually fail, just totally fail. And these are states that don't have medical cannabis programs, but these are also states that for some reason have passed medical cannabis but don't allow retailers. So these are all things that are really important to think of. Just because a state technically has passed some sort of medical cannabis law does not mean that our job is done and that anybody's job is done. Okay, if we can go on to the next slide. So now I'll dive a little bit more into the categories, but I'm also going to talk about trends that will be in this year's report. So the report's not published yet, but we've been doing all the grading, crunching the numbers, doing the research for the states. So while we're not unveiling what the grades are for the states right now, we'll do that in January on a webinar that, as long as you, follow ASA on social media or sign up for our emails, you'll get an invitation to that. But right now, what I'm going to do is talk about the trends that I'm seeing that will be featured in this year's report. So under civil rights and patient protections, the good news is that most states do provide arrest protection. So as long as somebody has a patient registration, they cannot be arrested for possessing cannabis. The bad news is that very, very few states actually have parental right laws or exceptions in place. And in fact, unfortunately, in some states, in family court, your use of cannabis, whether it be medical or recreational, it does not matter. Just your simple use of cannabis can be used against you in things like custody proceedings, and whether you can have custody or even visitation with your children. Employment protections vary widely from state to state. In some states, you're protected from being discriminated against for being a patient, but you're not protected if the job requires a drug test and you fail for THC. And then also the last one under this is states really are not addressing driving under the influence of drug laws. A lot of states, recently there's been an uptick in states of legislators and policymakers concerned with drugged driving or high driving. And so their answer to that is to have a DUID law in which they take a blood test, and if there is THC present above a certain level and the level's super low, then you are automatically guilty of driving under the influence of drugs. However, as we all know, if you're a medical cannabis patient, or if you're someone who uses cannabis with any frequency or regularity, you will test positive for THC, whether you are under the influence or not. So unfortunately, these are laws that are kind of a knee-jerk reaction, something that legislators think are a good idea to keep high people off the road, but they haven't really thought through to either provide an exception for patients who are going to test positive no matter when you test them, or have something else set up in place for them. And then an access to medicine. Thankfully, reciprocity is becoming more widespread. A lot of states that originally passed medical cannabis laws didn't necessarily provide for any kind of reciprocity where somebody can use an out-of-state registration to access cannabis in their state. But states are loosening those rules, even to the point where you don't have to register with the state you're visiting. You can just show up with your home state's patient registration card, and that's enough to give you both the legal protections in the state, but allow you to access medical cannabis in that state, which is very important for patients because it cuts down loopholes when traveling, for instance. More states need to do things to allow personal cultivation. Collective gardening, in the same sense, is almost non-existent among the states, to give individuals and patients a way to grow their own medicine. This also goes with affordability, because obviously if you can grow your own medicine, it's cheaper than having to go out and buy it from the dispensaries. And on the note of dispensaries, most states do not have sufficient retailers, not for the number of patients that are registered in the state, but also when you take into account the geography of the state. So some states are very, very big and only have a limited number of dispensaries, which means that some individuals have to drive multiple hours both ways just to get to the dispensary, and that is not acceptable. Well, then I can keep talking about the sufficient number of retailers. Originally, when these laws were passed in some of these states, they wanted to keep the number of registered and licensed retailers down because they didn't want this influx of cannabis in the state. And unfortunately, a lot of states have been slow to allow more retailers. And not only that, but have some sort of system set up and checks in place to ensure that, for instance, cities don't have one dispensary for every 20 patient, whereas anyone out of the city has maybe one dispensary for every 1,000 patients, and making sure that states that are big, like New York, for instance, has enough dispensaries upstate as they do in the city. Program functionality is another important one. It's how well does this program actually work? Some of the things that we've noticed, purchase limits are very low, and states need to look at raising the purchase limits. These should at minimum be in accordance with like traditional pharmaceutical prescription limits, where you can get a month in one trip. There's no reason to require cannabis patients to make multiple trips to a dispensary once a week, multiple times a week, when they make one trip to the pharmacy per month for their medication. Thankfully, telemedicine in the past few years, including last year, has been more widely accepted, and states are passing legislation to allow for registration, initial registrations as well as renewals to be done through telehealth, which of course helps patients access these physicians and get the recommendations that they need. Telemedicine really became popular and really started rising in 2020 at the start of the COVID-19 pandemic. ASA was instrumental in making sure that states around the country had alternative access methods for individuals to make sure that they could still safely access their medication. And along with this, ASA was able to have the states designate their medical cannabis dispensaries as essential businesses, allowing them to stay open. One thing that I haven't seen as much of that we do need more of are caregiver standards being reevaluated. So we've seen physician standards reevaluated. We've seen even patient standards reevaluated with doing away with condition lists or adding multi-year registrations, but there are still a lot of loopholes and fees even for caregivers. In some states, caregivers still have to have a background check, and they have to pay for the background check on themselves, as well as paying to register as a caregiver. So it's just as important for patients to look at those requirements as it is for patient requirements. And then the last one under functionality is there's very little access on school grounds for minors who use medical cannabis. This is in part due to federal law, because schools are in part funded through federal funds. They also have to abide by federal law or their funding is in jeopardy. And this has left patients harmed because they can't access their medication at school, but it's also tied the hands of lawmakers. However, some lawmakers in some states have done what they can to allow access on school grounds despite this federal conflict. And I wanted to highlight that especially because it goes with what we've been talking about yesterday and what we'll be talking about tomorrow, especially what Steph will be talking about as we talk about, you know, comprehensive federal approach. Is none of this happens in a vacuum. And each state, they may have their own individual laws, but that law and that impact does not stop at the borders of that state, and there are other things that can impact it. So none of these laws are insular. They're all impacted by each other. They're impacted by the federal law. And this is one of those things where even if states want to do something, federal law is standing in their way. Then if we can go to the next slide, affordability. This is a big one, and I think it's important to note right off the bat that when we talk about affordability, people automatically think of the price I'm paying at the register for cannabis. And that is a big part of it, but there are also a lot of other expenses that go along with being a medical cannabis patient. For instance, sales tax, there's no insurance coverage, registration fees that you have to pay, how often you have to register and renew it. Some of the trends that we have been seeing are states do, exempt medical cannabis from sales tax and excise tax, which has been great to see. And in the past year, there have been some states that hadn't originally exempted it from sales tax, but now medical cannabis is exempt. So they're still moving in a positive direction. Registration fees, by and large, are also coming down. Some states started having registration fees at $200 a year, and they're bringing those down. However, I do want to say that ASA will not be happy until there is no registration fee for patients, particularly in states that have already passed recreational adult use cannabis, it's unconscionable to require patients to pay a fee to access medical cannabis when adults throughout the state have access to it for free. That is unacceptable, and it is something that we're working to fix. But even states that haven't passed recreational cannabis, there should not be registration fees. The burden should not be placed on the patient's back to pay for the administrative costs the state has to run the medical cannabis program. So these are, oh, and as well as multi-year registration. So of course you have to pay your registration fee every time you register. And if you have to register once a year, that becomes expensive as well. So allowing multi-year registrations for patients not only brings down the cost, but also just the administrative burdens of remembering to get on and register, having to schedule another physician's appointment, or jump through more hoops. The name of the game is the less hoops necessary for patients to access medical cannabis, the better. Then if we can go on. Health and social equity. A big one in this is no states provide state program protections. There are a few states that require drug tests for things like Medicaid, food stamps, etc., and they do not provide exemptions for medical cannabis patients who may test positive just by virtue of being a patient. So instituting those protections to make sure that patients don't lose access to vital programs. Access for minors is typically good across all of the states. Minors and children using medical cannabis and their parents are often a core group on the state level advocacy, and they have been able to secure access. And in a lot of states, they've been able to do so without adding additional requirements for children, which is also important because there's no reason why a minor would need a second or third opinion from a physician who doesn't even treat them if they need to go get multiple opinions, versus an adult who can just get a recommendation from their physician. Underserved areas, unfortunately, are still very underserved. We have seen a resurgence, particularly in the last 2 years, looking to restore, do a little bit of restorative lawmaking to start to serve these underserved areas, not only, geographically, economically, racially, but within the criminal justice system as well, and making sure that things like having a criminal record doesn't stop you from being a caregiver for your child. And they've also extended this to the owner requirements as well. Consumer protection and product safety is a big section for us. This is very important that patients get medicine that is safe. However, this section as a whole is one that states are very lacking in. One of the problems is, again, each state is just making their own individual laws. A lot of times they're trying to reinvent the wheel. They're trying to start from scratch and build a consumer protection or product safety atmosphere in the state that works for that state. And so what we see is, because of that, you can't look at any two states and see identical safety measures. So this is something that we need. It's something that ASA thinks should come from federal coordination. Another unfortunate thing is training has not been made a priority for these workers and these owners from seed to sale. In some states, they do better with training than others. But we're particularly talking about people who are growing, making sure that they're educated as well as possible on all the safety aspects, including, pesticides, molds, other things like that, but then also training all the way up to the bud tenders who are front facing and talking to patients. And so they're educated not only about cannabis itself, but we're talking about safety in particular here, so they can help you ensure that you are getting the safest, most reliable product possible. And then on top of all of that, one trend that is very clear is that there needs to be more consumer education on safety and what testing results mean, things they need to look out for, why contaminants could be bad for them, things like that. Because unless consumers are educated, they don't know to ask for those things. Next slide. And then I'll just briefly touch on penalties here. One overarching trend that has really bothered me as I've been grading State of the States this year is this trend toward giving regulatory preference for adult use cannabis. So either states are passing adult use cannabis either in the legislature or through ballot initiatives, or legislators are preparing regulations for the eventuality of when they will do that. And unfortunately, then they leave behind patients and just totally forget that the medical cannabis patient works. Or even worse, they assume that medical cannabis and adult use recreational cannabis mean the same thing, and that by allowing adult use, they don't even need a medical program anymore. This is such an alarming trend that I'm not only seeing in the language of the laws they pass, but hearing them say. For instance, Colorado, in the past couple of years, they've had the single biggest rollback of any medical cannabis program I have ever seen. And this has been in favor of an adult use market. And so patients are really suffering in Colorado, particularly patients who aren't allowed legal access in the adult use market. Again, talking about minors specifically in that instance. So that's one thing that we as ASA and you as patients or doctors or researchers, caregivers, advocates, that's a message that needs to be reinforced time and time again, is that adult use cannabis and medical cannabis are not the same. I like to say that they're cousins, they're not siblings, so they have some things in common. They both deal with cannabis, but they also have separate families that they do separate things with, and their families need different things. And so the patient population is not a population that has the same needs as the adult use market. And because the adult use market doesn't have those same needs, they often get forgotten. So it is very, very important for advocates, whether your state has adult use recreational cannabis now or not, is to continue reinforcing this message that medical cannabis patients are still here, still need access to their medicine, and still expect the same protections as they've always received. We can go on to the next one, and I promise I'm almost done here. So this is how you can use the State of the States report. I want to remind you right off the top, make sure that you are subscribed to our mailing list and make sure that you follow us on all social media, and you will receive a notification when our report is published, as well as a copy of that report. Once you receive the report, you can help us by sending it to your elected representatives and regulators on the state level. We have an easy action alert that we'll set up for you to be able to do. We also send this to all legislators and regulators ourselves, but it is so much more impactful when it comes from you as local advocates and constituents. Review the areas in your state where you have lost points, and then look at other states that have done better, and you can find some lessons learned from the other states. That way you can take some things that other states have done to your representatives as an answer to say, see, we failed in this category, but here are the exact things that we can do to protect patients in this case. So you don't need to come up with new policy regulations on your own. We have them all there for you, either by looking through the other states, or we have a separate policy recommendation section specifically for that. You can also schedule a meeting with your representative to discuss the report and, importantly, to discuss your experience in the medical cannabis program. It's easy for us to, well, I'm not going to say it's easy. It's a lot of work for us to grade state of the states, but I think it might be easy for people to look at something with a lot of numbers on it and kind of have their eyes glaze over or have it not make a lot of real world sense to them. But advocates can use this report to highlight something that the state is doing wrong and say, I had an experience like this, and let me tell you about what it looks like when I go to the dispensary and have to pay sales tax, how much more I have to spend, or I have to go to the dispensary every week because I can't get a month's worth of medication, things like that. And then at your meeting with your representative, work on building a relationship and make sure to follow up with the representative. You are entitled to meet with your representative as many times as you want. And lawmakers often really love meeting with constituents and having constituent feedback and having relationships with constituents. So don't be afraid to start building relationships in the office, not only with the member, but their staff as well, and let them know that you're happy to be a resource for them for medical cannabis and medical cannabis patients. And then last but not least, you can also share the report on social media. Make sure that you tag ASA, but get the word out. Make sure that more of your friends and family see this report as well. And then if we can go to the next slide. And then we're looking for sponsors for our State of the States report, something that we do every year. If you are interested in sponsoring the report, or if you know of any companies that are interested in sponsoring the report, please reach out to us and let us know. And your brand logo can be on the inside of the report. It's great exposure. We send this report to over 8,000 legislators and regulators nationwide, as well as more than 3,500 journalists and publications. So that's a lot of people who will see your logo.
Thank you so much, Abby. And Abby is hard at work getting this report ready, and we will have it out early next month so that you guys can get this to your legislators right as they're looking at their legislative calendar and looking at what medical cannabis legislation they want to pass for the year. So thank you so much, Abby. On behalf of Americans for Safe Act staff, the board, and all of our members, we want to say a very special thank you to our Unity sponsors for the 2022 Unity Conference. This is our 10th annual conference, and I know many of these sponsors have been with us for the last 10 years. So I want to say a very special thank you to Dr. Bonners, to Metric, to 3C Cannabis Consulting, to Canopy Growth, Tacoma Wellness, the American Herbal Products Association, Cannabis for Cancer Declaration, Cannabis MD, Columbia Care, Council for Federal Cannabis Regulations, Healer, the National Pain Relief, Supply Chain OpEx Consulting, the University of Maryland School of Pharmacy, UKTI Collective, and Evoke. Again, thank you so much. This has been a great conference, and we couldn't have done it without you all.